Hi, I'm Greg Sawyer, Chair of Bioengineering at Moffitt Cancer Center, and I'm here today at SITC. This is the 40th anniversary, and we're outside of Washington, D.C., and I'm here with one of our clinician investigators, Dr. Saltos. Welcome to SITC.
Thanks, Dr. Sawyer. Happy to be here. It's a lot of exciting developments coming out, and we're happy to get a word out in all of it.
So tell us a little bit about your work in this area and what's happening right now in the field.
So I'm a clinical investigator focusing on lung cancers, and I primarily treat non-small cell lung cancer. There's just a lot of new developments in immunotherapy, whether it be immune stimulating antibodies, oncolytic viruses, which is the field of work I work in, engineered T cells, and just many other approaches that are all moving the bar a little bit for our patients.
So you mentioned that you were working in these oncolytic viruses, and how do they interact with the dendritic cells to make an effective therapy in this type of cancer that you work in?
Yeah, so oncolytic viruses they're engineered to infect cancer cells while not infecting the normal host patient cells, so that they won't cause an infection or contagious properties, but they'll kill the cancer cells and cause pieces of the tumor to release into the environment called antigens. And the dendritic cells are an important part of our immune system that recognize these little pieces, especially the ones that are different than our normal cells. And they'll then bring that to the attention of our immune system. They'll teach our T cells, which are the soldier cells of the immune system, how to find cancer cells that have this antigen and destroy them. And so it'll help our immune response against the cancer work more effectively.
So it's really interesting. It's like you're exposing the tumor to all of the immune cells to try to come in and basically clear up and eradicate that cancer. I understand you're working in a phase 1 clinical trial right now in this area. How's that going?
That's right. One of our clinical trials that we're really excited about is a collaboration that we have with it involves some of our basic scientists. An immunologist at Moffitt, Amr Beg, has in his lab worked with a small pharma company, Memgen, and there's a virus called MEM288, which we're now investigating in lung cancer patients. This virus is not only engineered to kill the cancer cells, but they also have some immune stimulating genes that are going to help facilitate those dendritic cells to do their job more effectively. We've treated about 15 or 20 patients with the MEM288 so far to date, and demonstrated it's been fairly safe, and it's also stimulated T cells in the patient's tumors and in their blood. And right now we're recruiting more patients and combining MEM288 with chemotherapy.
It's such an exciting time, and I know there's so much interest in this type of research and the work that you're doing here at SITC. It is really such a hopeful time right now for all of us. Thank you so much for spending some time with us today at SITC.